Mr. Burton is a 53-year-old man with metastatic prostate cancer. His son, John, has accompanied him to accident and emergency after he became unresponsive at home. While a doctor assesses Mr. Burton, Tricia, a senior nurse, is speaking with his son to get more information.
So, can you tell me what happened to your dad?
Yeah, it all started so quickly. I mean, he was fine this morning, and then he got a bit weird. He started saying he could see my nan, but she's been dead for 2 years. And then he got a bit tired, and he said he wanted to sleep in his chair, and that's not like him. And then when he stopped talking to me, I said, "That's enough, I'm calling the ambulance."
And he has not been ill before that at all?
Well, he was fine earlier on today. He was in a bit of pain, but that's nothing new for him. He's got the prostate cancer and he takes morphine, but he usually keeps it well under control.
And he took his medication today as normal?
Yeah, I think so. I brought his meds in.
Wow, the box is empty.
Empty? I mean, we only got it yesterday. He was in an awful lot of pain this morning. Maybe he's taken too many or something.
It may well be that taking too many tablets could cause this problem. I'll go see how he's doing and we'll take it from there.
Yeah, thanks, Tricia.
Although opioid analgesia is generally safe, it is important to be aware of possible systemic side effects. Sedation may occur with opioid use. Some people can find that they are too drowsy to do skilled tasks like operating machinery or driving, but this should be evaluated on an individual basis. Sedation is often the first sign preceding decreased consciousness level, and it can occur through a direct cerebrotoxic effect or as a result of respiratory depression. Decreased consciousness level usually only happens in the case of overdose, which may be accidental. Hallucination may also occasionally occur, more often on initiation of treatment or on increasing the dose. This can be very distressing, and an opioid rotation or dose reduction is usually necessary. How's it going in here?
Hi, Tricia. Yeah, he's doing fine.
Hi there, I'm Pat, the anesthetic registrar. I was seeing a patient nearby and someone told me that there is a patient with possible drug overdose, so I just came here to check if everything is under control.
Yeah, it's good timing. Thanks for stopping by. Mr. Burton's a 53-year-old gentleman who came in with a GCS of 9 without any obvious cause. He has a background of prostate cancer, but otherwise no comorbidities.
Okay.
He takes 10 milligram morphine tablets regularly. According to his son, he was in lots of pain this morning, so it may be that he accidentally took too much.
How is he doing now?
His blood pressure is holding at 96/65 and a heart rate of 56, so a slight sinus bradycardia. His respiratory rate is only 8, but oxygen saturations are 98 on high flow oxygen, and he seems to be maintaining his own airway currently without a problem.
Okay. Is he any more awake?
Yes, his GCS is 10, but he does have pinpoint pupils.
Well, I think you're right. It sounds like opioid overdose to me.
I've started fluids, and we're waiting for his blood results to come back.
Okay.
His blood gas shows he's got carbon dioxide retention, otherwise it's fine. And I was just going to go and speak to my registrar about giving naloxone, but I don't think we'll need it. And it looks like his airway is going to be maintained without a problem.
Well, that sounds sensible to me. You know how to reach me if you need me. Thank you.
Thanks. In an acute accidental opiate overdose situation like this, it all comes back to the basics. ABC.
That's airway, breathing, and circulation.
First, we have to ensure the airway is clear and maintained. If the Glasgow Coma score is 8 or less, the airway is at risk. If there are any concerns about the airway, you should seek senior help immediately. Use simple manoeuvres and adjuncts as per Resuscitation Council guidelines if you've been trained in how to use them. If these measures are insufficient to maintain the airway, anaesthetic assistance may be needed.
Next is B for breathing. Respiratory depression is a dose-related side effect. Larger doses cause more respiratory depression. This is directly due to the effect on the respiratory center of the brainstem. Watch out for this, especially in cases of sedation. Apply oxygen if needed, and if possible, wake the patient, as this helps increase the respiratory rate naturally. If unsuccessful, bag and mask or other assisted ventilation may be required.
The circulation can be affected with hypotension through both histamine-mediated vasodilation and central effect. Intravenous fluids can help increase blood pressure acutely. A postural drop in blood pressure on standing is also a common side effect in those taking long-term opioids. Sometimes naloxone is used to directly reverse opioids, but it has a short half-life and can even result in withdrawal symptoms, so should only be used under close observation and only on the advice of a senior clinician.
So, what did the registrar say? Should I get a monitor bed for him?
Yes, please, under the medical team, but we'll keep him here for a bit longer under close observation until we know he's definitely waking up.
How long do you think that would take?
Well, the length of effect is dependent on the half-life of the opiate concern. The half-life of the standard release morphine tablet is 2 hours, but when he does regain consciousness, we still need to get the team to monitor his renal function because morphine is excreted via the kidneys.
Great. I'll go update his son and let him know that he can come in.
Thanks so much.
Systemic opioid side effects can occur with any opioid use, although most side effects are more common in higher doses, like accidental overdose. They include sedation, hallucination, postural hypotension, and pinpoint pupils. More serious side effects like respiratory depression, decreased consciousness level, and hypotension should be treated as an emergency using an ABC approach. Treatment will vary depending on the opiate involved. Remember to get help early